every night or in 24-hour shift, if you ask an emergency physician doctor anywhere in America, in emergency rooms, they will see one or two patients every single day who will come thinking that they have a heart attack, and they will do all the workup EKG and then figure out they have a panic attack. And that visit will cost thousands of dollars. If it is just a panic attack, why was it not taken care earlier when somebody was having stress? Why couldn't they become self-aware and stop this progression into panic attack? Because there was no education. People ignore and think they are resilient and keep pushing until they cross a boundary, and now they are having a physical manifestation of their mind. See, the stress is inevitable. No matter what you do, you can get into an accident, right? That could cause a stress. How do you deal with this stress? Is that ever taught formally? The time has come with the increase in stress that we now need to formally teach human beings and upgrade their skills so that they know this is stress and what to do in it.
Dr. Shivam Dubey spent years treating people after the breakdown, the crisis at 2 a.m., the diagnosis that comes too late.
Then he asked a question his whole field is built to avoid. What if we taught the mind the way we teach the body before anything breaks?
Today, a Harvard-trained psychiatrist on what the system gets backwards and why he bet his career on prevention.
This is Authentic Conversations.
Real stories, true talk, told straight. Let's get into it. Welcome to Authentic Conversations. I'm Deanna Brown.
And I'm Jeffery Davis. Every guest has two stories, the one in the bio and the one they usually don't tell. Today, we're in the one place almost no one talks about honestly, the mind.
Dr. Shivam Dubey, trained at Harvard, sees patients across the hardest end of psychiatry. And somewhere along the way, he decided the whole model was pointed in the wrong direction, treating the crisis instead of preventing it.
So he started building a curriculum, a nonprofit, programs in schools on 2 continents, and books that put neuroscience next to ancient wisdom, which, as you can imagine, not everybody in the field loves.
We want the real vision of the journey, the doubt, the pushback, and what he believes works. Dr. Shivam, welcome.
Thank you, Deanna, and thank you, Jeff, for inviting me for this podcast.
Absolutely. Let me kick us off. You went from medical school in Delhi to a psychiatric residency at Harvard. What did that distance culturally and professionally actually cost you? And what did it teach you that the credentials don't show?
Well, definitely it was a culture shock in the beginning, but you won't believe it, how friendly, supportive atmosphere I received at Harvard. It was amazing that they are so welcoming. You know, what I really learned over there is positive feedback. Compared to India and America, I felt the positive feedback was a very important tool that my supervisors and attendings at Harvard helped me grow. And yes, there was a difference in cultures, but there was a lot of learning initially. And with the support of the attendings and the staff, quickly we were able to get into what we supposed to do. Basically, psychiatry, the medicine, is followed almost same across the globe. We are studying therapeutic modalities like cognitive behavioral therapy, psychopharm, medicine. I always was supportive and giving positive feedback to improve on anything I was doing. So it was amazing.
Awesome.
As I understand it, residency puts you face to face with people at their worst moment. And so my question is, was there a specific patient or night that made you think, we're doing this too late?
Yes, a lot of time. You know what happens is that every night or in 24-hour shift, if you ask an emergency physician doctor anywhere in America, in emergency rooms, they will see one or two patients every single day who will come thinking that they have a heart attack. And they will come and they will do all the workup EKG and then figure out they have a panic attack. And that visit will cost thousands of dollars to them and to the system when it's just a panic attack. That time I feel that if it is just a panic attack, why was it not taken care earlier by the primary care doctor or the psychiatrist or the psychologist or even before when somebody was having stress. Why couldn't they become self-aware and stop this progression into panic attack? Because there was no education, so that's why people don't ignore and think they are resilient and keep pushing until they cross a boundary, and now they are having a physical manifestation of their mind. That mind has
Hmm.
gone that far. So just one skill, which is self-awareness, if given to people and educate them, so they know that ignoring your stress or all these things in your mind going on could lead to something severe, right?
Mm.
So that is where I thought that we are spending a lot of money on just treating anxiety as a heart attack. That's a big blow to our services and our doctors who are trying to help people.
It seems like culturally, we've got people trained and pushed to the next level. Just push through.
Yes.
And they're not really embodied. They're not really taught to connect with their body and have a relationship with their body. And until their body is screaming at them and they're
Yes.
not sure what it's saying, then there's no communication or
So
heard communication.
yeah, there is a whole education about it, that with the
Hmm.
advances in neuroscience, this is not like, past that we didn't know about it. Now we really
Yeah.
know that what stress does to our body. Okay. It increases the cortisol, how it changes our reaction system, how does prefrontal cortex, amygdala, brainstem. It's a very common thing. It should be translated into the knowledge so that people are aware that if not paid attention or not taking care, it could lead to chronic stress, could lead to physical manifestations, even
Mm.
diabetes, hypertension, obviously anxiety and depression, but a lot of medical problems are also coming. And we already know with integrated medicine and all these things coming up these days, holistic medicine. But this education should be given in the beginning. That is what
Hmm.
I focused earlier on in my career, that instead of just treatment, we need to have a primary prevention so
Yeah.
that we educate people so that they know how to deal with it. See, the stress is inevitable. No matter what you do, you can get into an accident, right? That could cause a stress. How do you deal with this stress?
Hmm.
Is that ever taught formally, or is
Yeah.
it just randomly we learn from our parents or neighbors or from teachers?
Yeah.
The time has come with the increase in stress that we now need to formally teach human beings and upgrade their skills so that they know this is stress and what to do in it.
Yeah. So, Shivan, you just as you're speaking now, I'm thinking to myself, many people go into medicine to heal people. Many people go into medicine because it's a very well-renowned type profession, right? And yet you're clearly a brilliant clinician. Yet you decided to go into education and prevention instead. It sounds like you're making a bet here, right? You're
Yeah.
choosing that versus what is pretty well known in this country as being a very lauded position. What do you think you're risking in that choice? Is there a bet risk here that you've thought about and spent some time sort of talking with your family and friends about?
Actually, you are right. Doctors are considered healers. And I come
Mm-hmm.
from India. In India, they almost consider doctor as a god. Not now
Yeah.
anymore because it's becoming more
Right.
transactional. Well, it's making them more accountable. When a person goes to the medical school, you won't believe it. They do have this feeling that they're going to heal people. But
Mm-hmm.
when they go into the system and work with this system, they see there are a lot of barriers at times that
Mm-hmm.
makes the doctor feel that they can only do so much.
Yeah.
And actually, you know what? The doctors are having burnout these days. And one of the very common reason for burnout is moral injury.
Mm.
Moral injury, a doctor feels like when things happen which are not aligned with the moral values and ethics of a doctor. And it happens all the time these days. When insurance says that this medication is not covered for your patient, when insurance says your patient is allowed only so many days in a hospital, when you have to discharge the patient when you don't want to, all kinds of things. I'm telling you, the system creates a moral injury for the all the providers, even psychotherapists, you know, and chronically moral injury could create a allostatic load and actually cause burnout for the doctor.
Mm.
But doctor comes in the profession as healer.
Yeah.
When
Yeah.
I
Mm.
see a patient, I really want to heal the patient, not just give the treatment. But you have to understand that healing is not just for the body. The
Mm.
problem with current system is that it is based on materialistic world.
Yeah.
Since the industrialization of the nations happened 300 years ago, our education is built on materialistic world, teaching you how to live and explore the materialistic outside world. The
Mm-hmm.
inside world was left behind in our education. And that is what is causing some imbalance. So when a patient comes to me, I am taught to look at the patient as body
Mm-hmm.
and what the brain is causing some chemical changes in the body. So
Mm-hmm.
I'm trying to evaluate by looking at the symptoms and trying to evaluate the person from that perspective. That if I could find a diagnosis or something and then I treat it. That is what the doctors do these days, to
Mm-hmm.
find a diagnosis and treat the patient. But there is other things into it too. Biology is
Mm.
one thing, then there is psychology, then there is a social
Mm-hmm.
Right.
things which might be causing problems. And then there is a spiritual thing which we don't even
Mm-hmm.
touch sometimes. But
Right.
spiritually also could cause problems,
Yeah.
if your
Yeah.
Right.
your energy level is not aligned with your actions, that could cause cognitive dissonance. So
Mm-hmm.
there are a lot of things. So as a healer, when you come, definitely you are pushed back by the system to do
Mm-hmm.
what you really want to do, but people find their way. And what I found is the prevention, the education.
Mm.
And that's how I feel satisfied at the end of the day that I participate in full healing to my patients and creating this curriculum for the larger audience. I'm still practicing as a psychiatrist in California,
Okay.
Florida, and Virginia. I still
Okay.
Mm.
practice. And I'll tell you, I have learned a lot, and that may be a difference in our curriculum is specifically based on neuroscience and evidence-based strategies in
Mm-hmm.
last few decades, which have shown that if you teach these skills to human beings, they will have better mental health.
Mm-hmm.
So my focus is on more on clinical neuroscience for the education curriculum that we have created from preventive perspective. So I think
Mm.
my involvement in treatment helped me understand the patients better because I saw them face to face. I see the grief, trauma, I see the challenges they have. And then I can go back,
Mm-hmm.
rewind, and see what were they when they were 5-year old, 10-year old. What could have been done that could have prevented what they are presenting with now? And
Yeah.
that actually gave me a lot of understanding about the human psyche and what should go into this curriculum.
Mm-hmm.
Usually, this curriculum is developed by psychologists, actually.
Yeah.
Psychiatrists often do not create curriculums like that. Psychiatrists like MD doctor, more into medicine,
Mm-hmm.
psychopharm, those kind of things. But this is little different for me that I went into this direction of education and creating curriculum based on inner skills where I'm teaching children and adults self awareness, self management, resilience, responsible decision making. So,
Mm-hmm.
to make me feel satisfied and as a healer, that is my way out. Besides
Okay.
treatment, I'm also going to education. So, yes, I mean, sometimes my wife says, you better have just focused on being a psychiatrist and played
Yeah.
golf in the evening in
Right.
Florida instead of keep working on your curriculum and polishing it and improving it. But they understand. But you know
Mm.
what?
Mhm.
There's something definitely I'm carrying from my ancestors too. My
Okay.
mom, my dad, my grandfather, my uncle, my aunt, they were all teachers.
Oh,
And my
interesting.
maternal grandfather and grandmother and my paternal, everybody is a teacher. I just became a
Right.
doctor.
Well, your heart is very big, and the way that you're approaching this and helping people is actually with a level of attunement to who they are versus, a body part or something like that. I think that's important. There's a lot more going on in the journey before I show up with something actually wrong. But I wonder if there's something that you could tell someone, just one thing that they could do or start to do to head off the buildup of any of this. I mean, essentially what we're talking about is emotions, right?
Yeah, see, first thing is self awareness. That is the first skill we teach. And self awareness, when I was in my residency at Harvard, I was really taught this in a very good way. My program director was biopsychosocial, and I took that from there and put it in my curriculum. Biopsychosocial. If you want self awareness, you need to know your biopsychosocial. What is your biology? You are carrying the genes of your ancestors. You were born with this body, this hardware, this brain, which is already predisposed to certain things you don't know. You may already be predisposed to be more reactive than other population. You may already be predisposed to be anxious or get negative thinking. You don't know. So first of all, you have to understand your biology,
Right.
your family tree. If your parents or ancestors had some mental health problems, you should be aware of it so that you can take actions. That is first thing. Psychology. When you were born with this hardware and then you uploaded skills. Skills to ride a bicycle, skills to drive a car, skills to type. You also uploaded skills how you perceive, how you analyze, and how you react and respond. That is your operating system. You uploaded, it's like a software you uploaded while you were growing up. Now, if you uploaded a software which tells you you are not enough, or it tells you you are a failure, or if it tells you you are not good looking, or I don't know what kind of negative core beliefs you may have developed while you are growing up. We all are developing core beliefs, and that limits our potential. Today, if I got an opportunity to go into a party where I could meet somebody who could make me go further in my life, I may not go to the party because I feel I'm not welcomed.
Hmm.
We develop core belief as we are growing up. These are softwares we are uploading. So that's your psychology. There is a tool, Jeff, that we have developed. It's called Know Thyself, and I can share for your audience. It will help you find out your core beliefs. So I'm into developing some tools also for the people so that they can understand their biology, their psychology. So this tool, you learn your core beliefs. Then if you're aware of your core beliefs, and then you can actually change them. But if you're not even aware, you're
Right.
just at the mercy. Whatever has happened to you in last 20, 30 years life, you are at the mercy of it. So first know your biology, guys, then know your psychology, and then know your social factors affecting you. This is very
Yeah.
important before do anything about your emotions.
Awesome.
If you want me to give like a quick trick or something, the very simple thing is, see, all these emotions and all these suffering is coming from your mind
Hmm.
because you think you are the mind.
Mm-hmm.
A very simple exercise, if you close your eyes and take a deep breath and just look into your mind. Do you have a thought? Do you have a thought like, is there any thought in your mind?
Mm-hmm.
What about the next thought? Now ask, who thought that thought? Did you think that thought or it came automatically? How about this next thought? Did it come on its own or you were thinking it? If it is coming on your own and you're not thinking it, then you are not the thought. You are at the mercy of the thought produced by your brain, depending on what you have experienced in your life, what you have stored in your brain.
Mm-hmm.
What about a memory? Bring a memory forward. Think about a memory, good memory. And you may also feel good when you have this loving memory that you are watching. You brought this memory from your hippocampus. You can see it. You are not the memory. If you had a traumatic memory, you are not that traumatic memory. It happened to you. You can watch it. But if you think you are a memory, you are trauma, then you're going to suffer.
Yeah.
And that is what is happening, that people identify with this body and things happen to this body. And that is a cause of suffering. So
Yeah.
immediately I will ask people to become self aware and also start understanding that this brain is creating this mind, and the mind is created by the brain based on the experiences that they have got. And you
Yeah.
can watch it.
Got it. This
Exciting.
is yeah, it's exciting. It's super helpful, and I love it. We're all humans. Somewhere along the way, this is getting to this spot for you was an evolution, right? You know, you learn, you hit a wall, you learn, you hit a wall, you learn. In this journey, somewhere along the way, what was a moment that you felt like you hit a wall and you learned a lot from that experience because it was difficult?
You know, when I was starting this mental health education program, people a- all the time, they didn't like the word mental.
Hmm.
They said, don't use this word mental. We are not mental.
Yeah.
That was the biggest challenge I had, to keep the name mental health education. And then I asked them to look at the definition of mental health from
Mm.
WHO and CDC. If you go on the website of the WHO, World Health Organization, and CDC, what is the definition of mental health? And that definition very well describes what we teach in mental health education. So we hit a wall from people with the stigma and all that, but we kept researching and figuring out why we call it what we call it. Because mental health is a state where you are
Mm.
able to use your skills, you're aware of your skills and weaknesses, and you are able to stay functional and use them effectively. And that is what we teach. We teach skills so that you stay effective and you are able to use the skills that are needing to survive in this world. If you have a mental health disorder, that means you are becoming dysfunctional in some way, in some area of your life.
Yeah.
The mental health education is about telling you skills you stay productive in your occupational, personal, social, all areas. People were not wanting to talk to us, or parents were like, no, our kids are not mental. Why giving them mental health education? It was a big challenge to create this awareness and understanding what we are trying to do here. Also, when we were introducing mental health education as a subject in the schools, there was a lot of difficulties because there was a problem, like people say, how are we going to implement it, how are we going to find teachers, the curriculum, the book, and all that. They just want to do some random classes, but here we came with a comprehensive curriculum with assessment for whole school from first grade to 12th grade. It's a big task, and a lot of resistance we had to face. But I
Yeah.
think what really worked is the passion that we had. Passion, commitment. We kept going. It took us 10 years to actually
Mm.
get this through. Started in 2016. It's 2026 now. We are
Yeah.
right now reaching more than 50,000 children, and more than 30 schools, and 40 doctors we have trained. But it took us time. Just remember that if you are passionate about something, if your energy aligns with something, makes you feel happy, joyful, satisfied, don't give up. Learn
Mm.
problem solving, not ruminating on the problems. Think about solving the problems, and you will find your way. At least you will be satisfied at the end of the day that you gave
Yeah.
enough, that you
Uh,
did enough.
Speaking of results, Shivan, I think when we last spoke, you said you have a goal of reaching 1 million people. Strip away the number for a second. Let's make it a little bit more personal. 1 million people sounds like a great big number, just given where you're at after 10 years. But give me other measures of success, other things that will make you happy and make you confirm that you're on the right path and that you're doing the right thing.
Yes, basically, my vision is to educate people so that they know how to deal with the suffering, stress. And for that vision, I have created education programs which will teach people about the education of self, inner skills. There are 11 skills. This program to spread globally, and we have
Mm-hmm.
launched a fellowship in preventive mental health education. We now call it preventive mental health education. My goal is to have a fellow in every zip code so that if anybody has any problem, this person can be a source for preventive mental health. We run classes every Sunday, like in town hall style meeting halls, every Sunday in their zip code, in every community. We also call them mighty champions. And that is how we will be able to increase the literacy level of the mental well being. See, what is happening is that people are suffering because they are attached to their fake identities.
Mm-hmm.
They are taught that they are this or that. They are
Mm-hmm.
never taught how to go inwards and understand who they are actually. We are giving them labels. They get attached to those labels, and that creates isolation and suffering.
Mm-hmm.
So I want to challenge them and open their mind and give them experiential learning of themselves.
Very good.
That is how this mental health epidemic could be controlled through primary prevention
Mm-hmm.
of helping humans learn. So my vision is to have at least one mighty champion in every zip code who could be having meetings. That is how we're going to control this epidemic, having people who are willing to serve people.
Don't you have a free call weekly that
Yes,
people
not
can?
weekly, every
Okay.
single day.
Every single day. I want to go to this
7:30
call.
7:30 a.m. Eastern Standard Time. We go live every single day for humanity. And what we do there, it's called Mighty Champion Daily Life. In this, you will see psychologists, psychiatrists, life coaches will come online and discuss our curriculum. The session is divided into 4 parts. We start with mindfulness for 15 minutes. First part, yoga, meditation. And when you're calmed down, then the second part is problem solving. And in that, we will bring up a concept from neuroscience. And third part is called positive psychology, gratitude. And the fourth part is question answer round where you can ask any question. We are trying to bring psychologists, psychiatrists, life coaches to the people so that they can talk. We don't want them just stay in their office. We want
There
them
you
to
go.
come out we are giving them a platform so that they can come out and start their day, at least in Eastern Standard Time, with positivity, with
Yeah.
mindfulness, with an intention to solve problems for this world and for themselves and others. And why are we doing it? Because we have a very big curriculum. So anybody who's doing our curriculum, they can come in the morning and practice it and revise it.
Very good. Dr. Shivam, we're gonna wrap here, but in the show notes, put the link to your self-awareness tool that you mentioned earlier, as well
Yes,
as a link to the daily call so we can get our listeners to join you on your
that'll
journey.
be awesome.
Thank you, listeners. Dr. Shivam Dubey, a psychiatrist who looked at the system built to catch people after they fall, has decided to spend his life building the railing, saving the people.
If today gave you language for something you've been carrying quietly, pass it on to someone who needs it. That's how this spreads for.
Until next time, more real stories, true talk, told straight. I'm Deanna Brown.
And I'm Jeffrey Davis. Thanks for listening.
Thank you.
Thank you.
Wow. That's a man with his heart in the right place.
Yeah, a lot of passion.
Yeah, to me, it was like passion, purpose, and problem solving.
And he has an answer for almost everything, which is great.
He does. His energy is infectious.
Yeah. For the listeners, we told him in the beginning, make sure he smiled at least once. And he said, just once? So he's definitely a happy man, and he practices what he preaches. So I don't think he's in line for any type of anxiety attacks or anything anytime soon. So it's nice to see that kind of human being in this world these days. Great session.
All right. See you. Catch you next one.